Anticholinergics, final exam review. So for our anticholinergics, remember that we have two main drugs you guys are going to need to remember. Atropine sulfate is the first one. Keep in mind, atropine sulfate does come in a small animal concentration and in a large animal concentration. So what does it do to the heart rate? Atropine sulfate is going to increase the heart rate and reverse bradycardia. So when the heart is too slow, it's going to raise the heart rate. What if this goes too far? What condition is this called if it raises the heart rate too fast? Overcorrected, this is going to become tachycardia. So the heart rate is too fast. What does it do to the secretions, such as saliva? This is going to decrease secretions in the animal's mouth. So this might be something that our veterinarian might use as a pre-medication. More commonly, this is being a drug that they are using to help reverse an issue. So rather than give this prior to surgery for every single patient, what they are doing in most practices these days is giving this only as needed. This is one of our core emergency drugs, so you do need to make sure that you are calculating out what the animal should receive prior to surgery. And what does it do to the pupils? It's going to dilate the pupils. Continued, here is that large animal concentration label as well. What medical condition can it cause in horses? And this is ileus, so cessation of gut motility, or basically ileus is colic, where the guts are not moving as they should. So it's not used very commonly in horses. It can be in an emergency situation, but we are going to need to watch the horse for colic. Should it be given or avoided in general? And this is only given when clinically needed, especially in our horses and large animals. And what happens when rabbits are given atropine? 30 to 50% of rabbits are going to produce an enzyme called atropine esterase, and atropine esterase is going to break down atropine, which means that atropine is less effective in rabbits. That doesn't mean we can't give it, it just means that we either need to raise the dose or we may need to use a different anticholinergic drug. And what happens to the heart rate when it's used to treat dexdomitor-induced bradycardia? So dexdomitor naturally will cause the heart rate to be slower. This is part of the side effects of our alpha-2 receptors in the heart. But if it gets to be too slow when using dexdomitor, instead of giving atropine, we want to reverse the dexdomitor, and we reverse dexdomitor with atipamezole or antecedin. So adverse cardiac events can occur if we use atropine to treat dexdomitor-induced bradycardia. So first we reverse the dexdomitor, the dexmedetomidine, and then we will reassess the patient. If the patient after reversal is still having bradycardia, then we may be considering atropine sulfate, but of course this is the call that your doctor is going to make, not the technician. Our next anticholinergic drug is called Glycopyrolate, or Robenal V. You can see that this is a concentration of 0.2 mg per mil. What does it do to the heart rate? It's going to increase the heart rate, so this will raise the heart rate. What if it goes too far? What condition is this? So same as atropine, if we raise the heart rate too far or if we overcorrect, this is going to be called tachycardia. What does it do to secretions such as saliva? This is going to decrease the secretions such as saliva. And what happens when given to hypothermic patients? When we give this to patients that are too cold or hypothermic, this is going to be not as effective. So it will not work as well in patients that are colder. So we may need to use atropine instead. We also should, of course, be considering warming the patient and keeping them warmer to start with. But for longer surgeries, as the body temperature trends lower, glycopyrrolate will be less effective. And then is there a price difference? Yes, glycopyrolate will be more expensive than atropine. All right, that is it for our anticholinergics.